Bismillahirrahmanirrahim. Today my topic of presentation is World Health Organization and my name is Dr. Khansa Junaid and I am presenting under current supervision of Professor Dr. Saira Afsar. If you continue to work hard, success will follow you. Learning objectives of today's presentation is International Health Agencies Organizations, various types of international health agencies and organizations, WHO introduction, objectives, WHO various regional organizations, initiatives, recent updates and MCQs. By the end of this presentation, participants will be able to describe the International Health Agencies organization, types of international health agencies, WHO introduction, objective, WHO regional organization or WHO initiative. International health agencies or organization. A large number of international health agencies or organizations of various sizes provide international health assistance to improve long-term medical care in developing countries. The main aim is to provide to victims of war, famine, and natural disaster, especially in developing countries, and international health organizations predominantly provide long-term medical care. Various types of international health organization. It includes United Nations agency, bilateral agencies, multilateral non-government organization. United Nations include ILO, International Labour Organization, WHO, UNICEF, FAO, World Bank, UNDP, UNESCO, UNFPA. Some bilateral agencies include USAID, Colombo Plan, SIDA, DANIDA, and some non-governmental organizations include CARE and Red Cross. What is the multilateral agencies or organization? The term multilateral means that funding comes from multiple governments as well as from non-governmental or sources and is distributed to many different countries. The major multilateral organizations are all part of United Nations. The United Nations is made up of 192 countries from around the world. It is also called UN. It was set up in 1945 after the Second World War. It started with 51 countries. The UN has four purposes: to keep peace throughout the world, to develop friendly relations among nations, to help nations work together to improve the lives of poor people, to be center for harmonizing the action of nations to achieve the goal. Bilateral agencies or organization. Bilateral organization is a government agency or non-profit organization that is based in a single country and provides funding to developing countries. These organizations have similar job requirement as international organizations, but generally there are more opportunities for internship and entry-level positions with these organizations. The example of some bilateral organizations include United States Agency for International Development, the international which is known as USAID, which is one of the largest bilateral agencies involved in global health efforts. It is lead US government or agency that strives to end extreme global poverty while assisting resilient demographic societies to realize their potential. US provide funding for and support global health initiative in emerging pandemic threats, for example, family planning, AIDS, health system strengthening, malaria, maternal and child health care, neglected tropical disease, nutrition, and TB. Another is a bilateral agency, CDC or Center for Disease Control and Prevention, which is a part of US Department of Health and Human Services and responsible for implementing the public health initiative in US. Bilateral agencies actually the agencies which in addition to support multilateral agency, most industrialized nations also provide aid on country to country basis, attempting to match recipient need with donor objective and capacity to assist, usually subject to political consideration. For example, small donors are geographically selective. For example, Australia emphasizes Western Pacific neighbors, other emphasize their expertise, and for example, France emphasized its farmer colonies. Some of the bilateral agencies functioning in India are US Aid for malaria eradication, family planning and education. International non-governmental organization or NGO are also working at international level, which are increasing actively in development work as inadequacies of bilateral and multilateral response become more apparent. Sometimes it is known as people-to-people aid. Their activities are mostly specific, for example, targeting trachoma and cataract, while some are general, for example, aid for orphan. The largest NGO, international non-governmental organization working, is International Red Cross and Red Crescent Movement, which has national counterpart within most countries. It is mandated under the Geneva Convention to assist prisoners and civilians in armed conflicts, including visiting detainees and enabling them to communicate with outside world, setting up surgical hospitals and emergency team, rehabilitation of war disabled persons, and providing independent information on prisoners and war victims. Other well-known international NGOs are Oxfam, Oxford Famine Relief, which is known as Oxfam, Care International, Save the Children, International Alliance, World Vision, Medicine Sans Frontier, MSF, Doctor Without Borders were recently awarded the Nobel Prize 1999. Other agencies which both developed and developing country institutions, university, laboratory and consulting group are active in bilateral initiative, and some also work with multilateral agencies. And some philanthropist bodies contribute substantially to international health include Bill and Melinda Gates Healthcare Planning Organization and Evaluation Foundation, Robert Wood Johnson Foundation, David and Lucy Packard Foundation, and Aga Khan Development Network. Now WHO. WHO is formed at 7 April 1948. It is the specialized agency of United Nations. Its legal status is active. Its headquarters is located in Geneva, Switzerland, and its head is Tedros Adhanom, Director General. And parent organization is United Nations Economic and Social Council, and its website is who.in. Regional organization. The WHO has 6 regional organizations. These are located in Southeast Asian region, Africa, America, Europe, Western Pacific, Eastern Mediterranean region. And these regions located of Southeast Asian region located in the headquarter is India, and in Africa it is located in Zimbabwe, in America Washington DC or USA, in Europe it is located in Copenhagen or Denmark, in East Mediterranean region it is located in Alexandria or Egypt, and in Western Pacific it is located in Manila, Philippines. WHO headquarters located in Geneva, Switzerland. This is region I already talk. American region, European, East Mediterranean, Southeast Asian region, African region, and Western Pacific region. Objective of WHO: to develop and implement multi-sectorial public policies for health, integrated gender and age-sensitive approaches that facilitate community empowerment together with action for health promotion, self-care, and health protection throughout the life course in cooperation with relevant national and international partners. Currently, the main objective of WHO is health for all through primary health care, the attainment by all people of highest level of health, achievement of high standard health which differentially on the basis of caste, region, politics and social status is fundamental right of each individual. Vision. The vision of WHO is attainment by all people the highest level of health through primary health care. Mission: to lead strategic collaborative efforts among member states and other partners to promote equity in health, to combat disease, to improve the quality and lengthen the lives of all peoples of the world. The structure of WHO is WHO's organization of 194 member state. The member state elect the Director General who leads the organization in achieving its global health goals. It includes Secretariat. The WHO Secretariat includes experts, staff, and health workers of Geneva-based headquarters, member state to support them to achieve the highest standard of health for all people, and World Health Assembly, which is the WHO highest level decision-making forum. Each year, with delegates from all member states convene and the World Health Assembly to set priorities and chart a course for global health progress. WHO organizational structure. A global presence that puts countries at the center of our work. It includes long-standing Geneva headquarters over 6 regional offices. It includes 150 country offices and other offices around the world. WHO plays an essential role in improving local health system and coordinating the global response to health threats. Partnership. Global health partnership networks and alliances and initiatives have been established to raise visibility at unmet need and support coordination, provide financial support. In accordance with policy, the WHO, there the partnership demonstrate a clear added value for public health. The partnership have clear goal that concerns a priority area. Partnership are guided by technical norms, and the partnership provide appropriate participation of stakeholders, and the roles of partners are clear. Collaborating Center. WHO over 800 institution in over 80 countries supporting WHO program, and member states working with WHO are areas such as nursing, occupational health, communicable disease, nutrition, mental health, chronic disease, and health technologies. Definition, but by a definition, WHO Collaborating Center is an institution designated by Director General of WHO to form part of international collaborative network set up by WHO and support its program at country, regional, international, regional, and global level. Function and role of collaborating activities include collection, correlation, and dissemination of information, standardization of terminologies and nomenclature, technology, diagnostic and therapeutic, provision of reference substance and other services, participation in collaborative research, training, including research training, coordination of activities carried out by several institutions. Networks, committee, advisory group, and task force. There is also expert advisory panel and committee. Expert advisory panel and committee include WHO Expert Committee on Biological Standardization, Joint FAO WHO Expert Committee on the Food Additives, WHO Expert Committee on Specification for Pharmaceutical Preparators and also Essential Medicine, and WHO Expert Committee on Drug Dependence. There is a new initiative of WHO for modern WHO, which is a WHO transformational initiative. Its goal is clear: a modern WHO working seamlessly to make a measurable difference in people's health at country level. In 2018, this transformational goal, which is given in 2018, it's modern WHO. It includes strategic objective, include fully focused and aligned for impact, enabling a full potential of our organization, leverage the global community. Major transformation work stream include impact focused data driven strategy, best in class processes, new approach to partnership, collaborative and result focused culture, aligned three level operating model, predictable and sustainable financing, and the underpinning of these objectives include motivated and fit for purpose workforce of all these objectives. There is also a WHO framework, which is 30th Journal Program of Work 2019 to 2023, which define the WHO strategy for the 5-year period 2019 to 23. It focuses on triple billion target to achieve measurable impact on people's health at country level. The triple billion targets are to achieve by 2023, which include 1 billion more people are benefit from universal health coverage, 1 billion more people are better protected from health emergencies, and 1 billion people are enjoying better health and well-being. Activities of WHO. WHO is actually involved in prevention and control of specific disease, for example, immunization against common disease of childhood, global eradication of polio is outstanding example, epidemiological surveillance of communicable disease, also paid attention in its program of work to non-communicable disease like cancer, CVD, genetic disease, mental disorder, drug addiction, or dental disease. Development of comprehensive health services, appropriate technology for health. Family health is one of the major programs of WHO since 1970. It broadly divided into maternal and child health care. Chief concern is improvement of quality of life of the family as a unit. Environmental health. It advises government and national programs for provision of basic sanitary services. Role and function. It also including biomedical research, cooperation with other organizations, provides cooperation with other organizations, collaborate with United Nations, concentrate on morbidity and mortality statistics, advises government of country regarding maintenance of environmental health, carried out various such studies and also motivate information. It acts as a world library, issuing health literature and information. WHO aims for development of primary healthcare center for the whole population, promote MCH, and promote international standard of food, biological, and pharmaceutical products. Some activities include advocating for rehabilitation, treating tuberculosis, strengthening health sector response to gender-based violence and humanitarian emergencies, stopping multi-drug resistant gonorrhea, strengthening national food control system, translating science for better health emergencies preparedness, treating malaria, supporting malaria vector control, conducting strategy risk assessment for all hazards in countries, developing an urban health research agenda, promoting the health of refugees and migrants during COVID-19 pandemic, setting evidence-informed norms and standards on refugee and migrant health, strengthening health information system for refugee and migrant sensitive health care, improving the health and well-being of people, improving the health and well-being of people, improving measurement, monitoring, and evaluation of indicators of health, strengthening partnership with faith and community, improving understanding of health, aging, and initiative. Some initiative include access to COVID-19 tools, ACT accelerator, action on social determinants of health, being the healthy for be mobile, C cervical cancer elimination initiative, comprehensive mental health plan 2013 to 2030, COVID-19 emergency access tool, Decade for Healthy Aging, Defeating Meningitis by 2030, Eliminate Yellow Fever Epidemics, Epidemic Intelligence, Every Newborn Action Plan, WHO Codex Trust Fund, Food System for Health, A Future for World Children, and for various global action plan for healthy lives and well-being of all, care of injured, eliminate paint, lead paint, other collaborating safety collaboration of small global polio eradication, a global vaccine safety initiative, hand hygiene for all global initiative, health and energy platform of action, health for all film festival, and H5A standard operating procedures, hub for pandemic and epidemic intelligence, international electromagnetic field project, joint UNODC WHO program, malaria vaccine implementation program, medication without harm, empower approach, pandemic influenza preparedness framework, patient safety, preventing and responding sexual exploitation, abuse and harassment, rehabilitation 2030, safer, which is given for alcohol control initiative, strengthening national nutrition information system, Zoonosis Guide, United Against Rabies, WHO 1 plus 1 initiative, Alliance Against Trauma, Trachoma, Peace Initiative, Diabetes Compact, Rehabilitation Alliance, Laboratory for Quality, UHSC, and some initiative include WHO 1 plus 1 initiative, which is a global youth movement to end TB. It is given in 2019. WHO launched a new initiative for 1 plus 1 initiative on the occasion of World Tuberculosis Day. Aim is advancing engagement with young people and amplifying their voices to end TB. Youth can have multiplier effect in the fight to end TB, and it target include larger target and in TB by 2030. Its vision is the scaling up global, regional, and national action to prioritize, invest in engagement with young people in the TB, mobilizing and empowering young people in the fight of TB, recognizes the contribution and participation of young people, respecting the diversity of young people and engaging them. Its action is the little action and big impact. The WHO 1 plus 1 initiative for TB include little action, big impact, each one teach one. There is also Tripariate Zoonosis Guide, which is developed by WHO. It includes multi-sectoral One Health Organization, mapping country context, planning and preparedness, surveillance, information sharing, workforce development, risk communication, joint risk assessment, investigation and response. There another strategy given by WHO is SAFER initiative, which is world free from alcohol-related harm. Safer include as for strengthen restriction on alcohol availability. A is advise and enforce drink driving countermeasures. F facilitate access to screening, brief intervention and treatment. E enforce ban on comprehensive restriction on alcohol advertising, sponsorship and promotion. R raise prices on alcohol through exercise taxes and pricing policy. There is also Mekong malaria elimination program, the access to COVID-19 tools accelerator. Future target include poliomyelitis, a global interruption of transmission of poliomyelitis in 2019, measles reduction in 2010, immunization ensure full immunization children under 1 year 90% 2015, reproductive health 2015, avoidable blindness in also 2015, chronic disease reduced death from chronic disease in 2015, influenza vaccination coverage of elderly population at least 75% 2010, iodine deficiency 2015, nutrition half the proportion of people who suffer from hunger in 2015, child mortality reduced by two-thirds under mortality, maternal health reduced three-quarter, maternal morbidity given in 2015, target HIV, AIDS, malaria, TB in 2015, environment the proportion of people without sustainable access to safe drinking water in 2015, development in cooperation with pharmaceutical companies in 2015. Major achievement of WHO include smallpox eradication, Alma-Ata Conference, Global Strategy for Health for All by 2000, and Millennium Development Goal. Conclusion: although WHO has both opportunities and challenges, its contribution is to increase the quality of life and living standard globally. Recent updates. Midterm result to include WHO include that the world needs WHO new more than ever. It is given in these a year ago vaccine was still a distant hope. Now they are giving us a real hope of bringing the pandemic under control. Even so, the shocking disparity in global distribution vaccine is another painful reminder in equities. The past year in the WHO mid-year examination, the most testing in our organization history, it has been demonstrated more than ever, the world needs a strong and sustainable WHO. And it includes 2020 years like other special look into the indispensable role of WHO in COVID-19 pandemic. It's fighting on two fronts to eradicate polio and to defeat COVID-19, fighting COVID-19, transforming WHO. Progress towards impact on health, well-being, and security, achieving 1 billion more people benefiting from universal health coverage in 2020, achieving 1 billion more people better protected from health emergencies, achieving 1 billion more people living with better health and well-being in 2020, a more effective and efficient WHO providing better support to the countries in COVID-19. WHO COVID-19 Solidarity Therapeutic Trial, which is also organization in this, there is 4,200 hospitalized patients in randomized control trial. 52 countries include 600 hospitals and 2,000 researchers. In this trial, there is the WHO Solidarity Plus trial will initially evaluate three treatment arms: artesunate, infliximab, imitinib, in addition to local standard of care. These drugs are chosen after careful consideration of potential drugs by independent panel of experts. The drugs were donated by the respective manufacturer for the trial. It include artesunate, imitinib, and infliximab. The solidarity trials work in this. The WHO evaluate drugs by randomizing their effect on important outcomes. It involves collaboration among hundreds of hospitals in dozens of countries. It began by evaluating four repurposed drugs and now guided by independent expert groups. There is also another trial which is Solidarity 2 and Global Serological Study for COVID-19, which is led by WHO that promote implementation of serological survey. Solidarity 2 provides a collaborative environment for public health agencies and academic institutions around the world. Scientific breakthrough come through this solidarity to include global sharing of a well characterized panel of sera to test the performance of serological assay, facilitated access to high quality antigen specificity, standardization of serological assay methodologies, promote sharing of study protocols, support with analysis of individual, a meta-analysis of finding across surveys from collaborator to provide a global understanding of seroprevalence and seroincidence of SARS-CoV-19 and potential impact of different control measures. Another initiative of WHO is accelerating the safe and effective COVID-19 vaccination. Highlights of these WHO actions so forth include harnessing a global coalition to develop and evaluate candidate vaccine as quickly and safely, mapping candidate vaccine and their progress across the world, defining the desired characteristics of safe and effective vaccine to drive and focus that is public health and needs oriented, coordinating clinical trial across the world to accelerate multiple actions with the aim of providing a safe and effective vaccination as early as possible. Now this is time for MCQs. MCQs 1. An ABC developing country has high child mortality due to intermittent diarrheal outbreaks and the severe lack of healthy workforce. During the most recent health meeting, the ABC country Ministry of Health determined that the government should seek support from organizations that improve long-term medical care in the country. Which agency or organization will provide the best long-term medical care in the country? International Health Agencies, National Diarrhea Control Organization, National AIDS Control Organization, National Institute for Population Sciences, National Institute of Health and Family Welfare. What will be the option? Uh, a Alpha will be the option as in this scenario, International Health Organization, that country don't fulfill its national program, not fulfill the need of child, and there is a lack of funding and also see a lack of workforce. Therefore, the country should seek uh, to provide the best long-term medical care in the country should seek the help from international health agencies. MCQs 2. An XYZ developing country has high maternal mortality due to poor antenatal and postnatal care and severe lack of community health officers and maternal and child health officer workforce for last 5 years in rural areas. The Ministry of Health of XYZ country lauded a single governmental organization from developed countries to deliver community case management and with community health volunteers in rural areas to increase coverage of reproductive health services. The type of agency or organization involved in this scenario is bilateral agency, international non-governmental organization, multilateral governmental organization, multilateral non-governmental organization, or unilateral agency. In this scenario, the country, but
A.
alpha, yes, because it's a bilateral agency, because the country allowed a single governmental organization from developed countries to deliver community case management, and in bilateral agency, the a single industrialized country providing fund and technical assistance to developing countries. MCQs 3. In an ABC developing country, there are a lot of emerging pandemic threats, family planning, HIV/AIDS, health system strengthening, malaria, MCH health problem, neglected tropical disease, nutrition, and tuberculosis. A government agency from XYZ developed country provides fund and assistance to the ABC country, which is the organization providing funding to ABC developing country. Food and Agriculture Organization, International Child Emergency Fund, United Nations Children Fund, United States Agency for International Development or WHO.
B.
D. United Nations State Agency for International Development is a large bilateral funding agency which provides a lot of funding, especially the emerging pandemic threats include family planning, AIDS, and health system in the developing countries. At the as a government facts a developed country provide fund and assistance to ABC, as in this scenario the developed country single country provide funds to ABC country. Therefore, it should be some sort of bilateral agency, and bilateral agency is the United States agency. So the correct answer is D. The World Health Institution is the United Nations principal international health organization with headquarters in Geneva. It is technically an international intergovernmental organization connected to United Nations. The World Health Organization was founded in a 1942, 1943, 1944, 1946, or 1948. What will be the correct answer? When
48.
Yes, E is the correct answer. WHO was founded in 1948. WHO regional divisions were established between 1949 and 1952 and are based on Article 44 of WHO Constitution, which allows the WHO to form a single regional organization to suit the special needs or specific needs of each designated area. WHO Southeast Asian region office is based in Alpha, Brazzaville, Republic of Congo, Cairo, Egypt, C. Copenhagen, Denmark, New Delhi, India, E. Washington, DC, or United States. What will be the correct?
D.
Correct option, New Delhi, India. The WHO Southeast
Yeah.
Asian region is based in New Delhi, India. MCQ 6.
D.
An ABC developing country has infectious disease, particularly AIDS, malaria, and tuberculosis. Various international health agencies, particularly WHO, provided funding and technical support. The main objective of WHO is the attainment by all the people of highest possible level of health, mainly through primary health care, quaternary health care, restorative care, secondary health care, tertiary health care. But
A.
alpha,
A.
A.
yes, alpha is a correct answer. That main objective of WHO is attainment by all people of highest possible level of care to primary health care level. Therefore, alpha will be the correct answer. MCQ 7. A new modern WHO approach has been operated in XYZ developing country due to many non-communicable disease. WHO new work includes the work stream focused on establishing and operationalizing an impact focused data driven strategy and new results focused collaborative culture. The new approach applied in this country is A. Behavioral approach, B. Psychological approach, C. Situational or contingency approach, D. Transformational approach, or E. Translational approach. What will be the correct answer?
A.
Delta. The new approach, which is established by WHO in 2018, is the transformational approach, which include the work stream focused based on establishing and operationalizing impact force data driven strategy, and it includes collaborative culture. Therefore, the new approach which is operated in XYZ developing country is the transformational approach. MCQs 8. An XYZ developing country has an increased prevalence of tuberculosis among youth for last 10 years. The National Tuberculosis Program of that country, in conjunction with WHO, developed the National Youth Movement Against Tuberculosis, which aims to reach out to young people and educate all primary school students on TB knowledge and best practices for preventing TB and lung disease. The initiative of WHO to end global tuberculosis among youth is the A. WHO 1 plus 0 initiative, B. WHO 1 plus 1 initiative, C. WHO 1 plus 2 initiative, D. WHO 2 plus 0 initiative, and WHO 2 plus 2 initiative. What will be the correct option? Beta is the correct option. The WHO launched an initiative for ending the TB, particularly the target population is youth, and it includes WHO 1 plus 1 initiative. So beta is the correct answer. MCQs 9. Research conducted in the ABC country showed that 74% of violence cases were alcohol positive, 54% were traffic collision, and 32% trauma were from other accident. In collaboration with other international organizations, the WHO launched a new initiative that can help the government reduce the harmful use of alcohol and related health, social, and economic consequences. The initiative is known as GAVI. Empower Initiative, Safer Initiative, WASH Strategy, or WHO 1 plus 1 initiative. What will be the strategy?
Beta.
C.
C. C is the correct answer. WHO has started initiatives for alcohol related accidents and deaths. Is safer initiative. C is the correct answer. Empower is actually for smoking, and WHO 1 plus 1 initiative, as I already told, is for the tuberculosis. C is the correct answer. Safer initiative. MCQs 10. WHO is United Nations specialized organization controlling international public health. The 30th General Program of Work of the World Health Organization is a new instrument developed to measure and enhance WHO impact on health at the national level. These aims are closely related to sustainable development goals in terms of the measurement. The initiative known as in the 30th Alpha Empower Initiative, Safer Initiative, Triple Billion Targets, WASH Strategy, or WHO 1 plus 1 Initiative. In the 30th Journal Program of Work of WHO.
C.
C. C is the correct answer because in 30th Journal Program of WHO, which is GPW13 of World Health Organization, it develops a new instrument to measure and enhance impact on health at the national level. And in this, their target is set is triple billion targets. And this is closely related to SDG goal. Therefore, the C is the correct answer. And other initiative Empower is for smoking, Safer initiative for alcohol, WHO 1 plus initiative for TB. This initiative is triple billion target C. This is the key of MCQs, references, and thank you.
Thank, thank you very much. Very nice presentation, Dr. Khansa, and very well done. It is a straightforward presentation, and I'm very glad that you did it. There is no question in MCQ or in a chat box, so thank you very much, and see you tomorrow, inshallah. Allah Hafiz.